I think listening to your customers, in a sense, in any kind of organisation or business is always helpful. That the clientele that you're going to serve should have some sort of input and sort of help you shape your service, and your service will be a lot more responsive and probably a lot more efficient in the end if you do that. Where if you do it in isolation away from where you're going to deploy it, no good plan is going to survive with contact with the enemy. So it would help if you brought the clientele on board.
The one thing I've noticed, and it's probably obvious actually, but homeless people, they've got no self-confidence at all. I think they've been kicked down so hard, and for some people for so long, that they've just lost the confidence to ask for help, and don't even feel they deserve it or expect it.
What stopped me during my period of rest sleeping was pride, embarrassment, shame. It shouldn't happen to me. It only happens to people coming from broken families. And as you know, as I had no major health issues during my fit, I just carried on, and the day-to-day activities overtook any thoughts about looking. I didn't even look. Maybe I could have looked in the library on things, but I didn't. You know, maybe if there was an article. It's having the courage to go and ask for help, and don't judge the judge. But it's very hard to do to not judge yourself.
Before the period I went into hospital, I didn't probably engage with the health services as well as I should have. If you're relatively fit and able, your interactions with the GP are going to be pretty limited. Going into the hospital, getting discharged from the hospital, I didn't have a GP to go back to. The area that I was in was quite far from the area that I suddenly now found myself into, and re-accessing it, I didn't know how I could do it. I thought I need utility bills, I need ID and so forth, all things that I didn't have at that time. Apart from walking into an A&E, that was my only version of access to the healthcare. On the day that I left hospital and I was given my medication in the bag, there I was, I made my way out the hospital. There wasn't much in terms of directions, or to be fair, I didn't tell my scenario to them. I suppose pride got in the way. Firstly, I thought by telling the doctors, it probably wasn't going to change my scenario, one way or the other. Number two, I didn't know what the scenario was. You know, it was still a bit up in the air. Three, it probably was denial, a little bit of pride in the same way to expose that to another person.
The problems that staff might have in primary care is that these patients have genuinely got multiple problems, and that Hewett has got a complex story, and that story can be really difficult to tell for the patient, for all sorts of reasons, for memory problems, for psychological distress reasons, because they've got language problems, because they've got literacy problems, and also these patients can present with behavioural problems which often relate to their mental health or addictions. And they can have like special needs, like for example they might have a dog that needs looking after or luggage that needs looking after, and that can genuinely create problems for people on the front line in healthcare, in the terms of the fact that they don't have the time or the capacity, and they're not being supported to manage that, so that can genuinely be challenging.
I think it's a matter of justice, of social equity, and most of the people that you talk to who work in this area went in for, when we apply to go to medical school, we say we're interested in science, we're interested in helping people, and we want to do something worthwhile. And then we get that beaten out of us by the system, which is all about efficiency and cost effectiveness. But many of us in healthcare keep that spark of wanting to help people, and increasingly realise that it isn't simply about inequalities, it's about equity, it's about living in a just society in which healthcare provision is proportionate to people's needs. So I've kept a passionate wish to ensure that the NHS, of which we're also proud, keeps that concept of equity at the heart of everything that it does.
The first thing that all hospitals and primary everyone has to start with, And this costs no money. So always, all you ever hear in the NHS these days is, oh, we haven't got the money, we haven't got the money. It's just boring. All they need to start with is compassion. And that's free. And they've all got compassion because that's why they went into the NHS in the first place. The nurses, you know, are lovely, the doctors lovely, everyone's lovely. Domestics, you know, they'll be the first to take cups of tea. Actually, you know, and so compassion is number one. Nothing, costs nothing.